Hello, everyone, and welcome to the 12 Days of Cortisol Christmas. My name is Winslow Dixon. I'm the CEO of Adrenal Alternatives Foundation, and I'm so excited to introduce you to Dr. David Martine. He is a very incredible person. So, Dr. David, how about you introduce yourself?
Well, I'm Dr. David Martine. I've been practicing in Fort Myers since 2006, but I had a practice in Colorado before that. I've been doing acupuncture. I'm an acupuncture physician here in Florida. I've been doing it for 26 years now, so I've had a bit of time doing it. And my education is pretty much, I went to college early on, became an electronics engineer, had a whole career doing engineering, and then I had a health problem, and nothing worked for me. I tried everything, went everywhere, and finally went to an acupuncturist, and it worked right away. So I thought, well, I should just study that because it intrigued me. So I studied that, and then I decided to just go right into it and make a new career. I decided to reinvent myself as an acupuncturist. And so that's what I've been doing for the past, 26 years now.
Wow. So needless to say, you have a lot of experience underneath that license of yours. That's awesome. So I know that acupuncture is considered alternative medicine. So for those that have never heard of acupuncture, can you explain what it is?
Yeah, acupuncture is a form of natural medicine. So we believe the body can heal itself. You have all within you a lot of the resources to heal yourself. So nothing against Western medicine. We love Western medicine. It is great at some things. If you have a broken bone, you should be going to get that fixed because the tools and the technology is there. But so many things are not well addressed by Western medicine, like the chronic illnesses and lifestyle problems and things that people get in trouble with, chronic diseases. And so we help really a lot with that, stress, anxiety, and that sort of thing. Oh, let me just hand off my phone.
Absolutely. While he's handling that, I'll just give you guys a little bit of background. So the reason that I wanted Dr. David to come on to this event is because I started seeing him personally because of my adrenal symptoms. As you all know, I have primary Addison's disease. I'm cortisol deficient. I'm on cortisol replacement, and I have a lot of trouble with quality of life. I wasn't sleeping well. I was having a lot of anxiety and a lot of migraines. And I called Dr. David, and I just looked up, I was just looking for basically anything just to improve my quality of life because I'd been through the top medical systems, and I just thought, okay. So I called the clinic, and I was like, look, I don't know anything about this. What is this? And he's like, it doesn't hurt. It's fine. Just come try it. And so they ended up being there on a Saturday for whatever reason that they don't usually do it. And I ended up coming in, and he did some points, and he did this one point on my head, and you have to tell me the pronunciation of that one.
By way.
So the by way point. So can you explain that?
It's a place where a lot of things meet, meetings point.
Yeah. So he put this pin in my head, and it was a snooze button. And I was like calm, and I felt chill, and I was like, what is this? And I think I even said to him, I was like, am I on drugs? He's like, yeah, your body's making its own drugs. It's endorphins. And I was like, okay. So I thought, all right, I got home. This must be a fluke. No, whatever. And then I went back, and I now see him twice a week, and even more than that if I'm having wonky days. And I've just been amazed at how it's been great for symptom management. My migraines, I can go into his office with a migraine and come out not with the migraine. And I don't know what kind of magic it is, but what has been your experience with chronic illness and their symptoms, and how acupuncture has responded to it?
Well, acupuncture is really useful for chronic problems. Natural medicine, and Chinese medicine is a natural medicine. We do acupuncture, of course. It's one of the things we do, but there's herbal medicine. There's physical medicine, that we use. There's a whole variety of techniques, and even food. We It's important what you're eating, what you're drinking, what you're thinking. I always talk about the air you breathe, the water you drink, the foods you eat, the thoughts you think. And so people often don't realize that they're responsible for the whole person. And so natural medicine looks at the whole person. And so for chronic diseases and problems that people can manage pretty well, something like diabetes, it's completely manageable if you are willing to do the work to manage it. Right? Well, type 2, type 1, you're born with a problem. But most of the diabetes we see is type 2. And so we treat a lot of chronic diseases. We treat a lot of, pain. We're very good at managing and helping people deal with pain. Sometimes we can get the pain to be gone completely. Sometimes even in one visit, we can get the pain gone. And so, matter of fact, many times people often, they come back after a year or so and they say, my arm started hurting again, or something. They've been pain-free for a long time. So where to start with all that? I guess maybe start with pain, because we see so much of that. The main thing we see, certain like headaches, pain. Pain is a big motivator. Yes. And so sometimes when people are in pain, they've tried Western medicine and it hasn't worked for them, and they're looking for another answer. Then they knock on my door. Usually I'm not the first door people knock on. They probably knocked on.
Guilty of that for sure.
Yeah, right. You probably went to a lot of places before you came here. And so we end up working with pain. We can reduce pain quite a bit and help people manage their lives so that they can be out of pain. And sometimes it's more than one thing that we do. The acupuncture helps. Sometimes there's herbs. Certainly there's diet and things that we can make changes to. So pain is a huge factor in this business. And from neck pain to headache pain to toe pain, everything we see is pain. Digestive issues. We see a lot of digestive issues, people that have had, and they're chronic problems, that Western medicine doesn't do too well. You can't take a pill always and make your pain, your digestive system start to work. And so we can help your body heal itself so that it starts to work again, and you process food properly. So digestive issues, anxiety and stress is a huge thing. People come because the world is really stressed out these days. People they're watching the news or they're political, whatever leaning. The system is designed to get you stressed and to keep you engaged. And so people do get engaged, and it causes them a lot of trouble. And it can affect your health, not just make you uncomfortable emotionally, but it can start making you physically ill too. Like what the thoughts you think, they can be toxic over time. You're stressed long enough, and pretty soon your liver starts to give you trouble, or your kidneys start to give you trouble. And so we work to help manage that very well, actually. So that kind of stress and anxiety and any kind of trouble. We actually even have acupuncture points we use for grief and loss, fear, like maybe someone has lost a pet or a loved one. And you have to grieve. It doesn't take your grief away, but the grief doesn't have to rule your life. And so we manage it that way. And so we work with a lot of the emotional problems people have. Some people come in, they're manic. Some people come in, they're depressed, and everything in between. And acupuncture is very good at managing that. So, and it's kind of a long history. People think of it as a folk medicine, but it isn't. They're still doing research on this. Yeah. Mostly in Asia, right? They're doing the research, but they try points. They do research to see how it works, and it's a lot of testing and trying again, and testing and trying again. But it's not like you can do a placebo too well, because it's kind of sham acupuncture is like sham surgery. You don't sort of do a knee replacement and see how it compares to a real knee replacement. It's either you kind of do it or you don't do it. So we work a lot with that, and anxiety and stress and fertility. People don't think about that very often, but we can help with that. And the other main things we see, well, I guess that's mainly everything that brings pain, and people that have your situation where you have ongoing problems, your systems aren't quite working right, and for some people, we can't really fix them all away, but we can manage their symptoms.
Improve quality of life.
I see a lot of that, the quality of life. I see a lot of that with people that may have been treated for cancer. And of course, the cure has its own problems, and we can help them get a better quality of life if they've been, damaged with radiation. Of course, I'm not throwing any stones. That may have saved their life, that whole Western method. But in the aftermath, you have to get your nerves back, or if you've been, you've lost feeling because of radiation or chemo. Those are very aggressive treatments, but they can make your life hard, and there's some things you can do to make your life better.
Exactly.
Mhm.
That's honestly one reason why I'm so appreciative that you came on to this interview, because what I love about alternative and holistic medicine, especially TCM, is that it kind of gives hope back to you. I feel like in Western medicine, you'll go through all the medical stuff, the surgeries, the medications, and then they'll kind of go, okay, we've done our thing, it's you, and what I love about specifically your clinic is you work with people on diet, you work with people on, the mindset, you work with people on, applicable tools that they can use to improve their lives. And like you said, NIH, if you just go on their website, you can find a ton of research where acupuncture has been beneficial. So I love that this gives people their autonomy back as far as their health. So what lifestyle modifications would you recommend for someone that has a stress disorder such as mine?
Well, such as yours, you have a very specific one, very complicated one. So for most people, though, it's really important what you eat, having a high quality food. And there's so much junk out there. You go to the grocery store, anything you pick out of a bag or a box is preservatives and that sort of thing are in it. If you were to go buy a pie in a box, and you have to think, what happened to that pie? Someone made that pie many weeks ago. They cooked it in the oven. They got a bunch of pies together. They piled them up, and maybe it took them a week. And then they put it all in a container, and then they waited a day or two. And then the truck came and picked it up and hauled it to a center. It stayed for another few days, and it went to Des Moines, Iowa, to another distribution center, and stayed for another 10 days. And it got distributed to the store, where it stayed another 10 or 12, 15 days. And it goes to your refrigerator, and maybe a day or two in your refrigerator, maybe less if you're hungry, right? But the thing is, if you were to make your own pie and it had to be good in 2 months, the preservatives that you would need to put in that pie to make it still good, look good, taste good, they're not in most people's pantries.
Yes.
They have to put something just to make it so that it's edible or it looks edible. You can debate whether it's edible, but whether it looks edible in that much time. So you have to think everything that's in a bag or something like that has had to have something to make it last on the shelf. And so I think one of the biggest things I tell people is cook your own food. If you possibly can, don't be eating out of a bag or a box or anything. And there's so much junk out there. There's pure chemistry that
Franken foods are alive for sure.
Well, I always pick on Cheetos, but it's you could say, is it food? It's not really. It's chemicals that they put together to have to give you a taste, and of course you're purchasing the taste, but you're not purchasing a healthy thing, and so people are eating for the wrong reason. They're not eating to nourish their body. They're eating to nourish this taste or whatever they're looking for. And of course, the more you try it, the more you want it. I think that's certainly true of a lot of the sodas out there. I won't name their names, but sodas really you're purchasing a taste. It's really not a lot of nutrition. It's not going to be good for your eyes or your hair. It's not going to make your skin better. It's just going to, give you a taste that you might like. And it might give you a mental addiction to it. Like I think some of those sodas do get addictive, especially the diet sodas.
Gotcha.
Mhm.
And you mentioned like addictive things with your mind too. I know that a lot of us have probably heard the nutrition thing, but I don't think a lot of doctors are talking about how thoughts can be toxic. So can you
Oh,
explain that?
yes. Well, I always explain it kind of the same way because anybody's had a close call, has felt fear a little bit, and they felt a little shaky because something almost happened. Maybe they didn't get hurt, but they felt like they might, and they felt shaky afterwards. That's because your body chemistry changed. You felt the emotion fear, and your body chemistry shifted. It took your resources for all your internal organs, and it pushed them to your muscles. So you could, fight or flight response.
Yes, and that's so dangerous with adrenal diseases because you don't have the enough to do that.
That's right. And so fight or flight responses they take your energy and they move it to your muscles. And they also change your brain. It doesn't make you dumber, but if you're running from a line, you don't need to have calculus or poetry. You need you need to
You need to
have
run.
you need to be super aware of how far things are, how fast things are moving, how fast, should you turn, should you fight, should you climb, what are you going to do? Those things, that part of your brain needs to be turned on all the
That's a
way.
good point that pushes you into hypervigilance. And that's one thing that I've seen is like when I get, those low cortisol symptoms and when we're artificially doing it, you tend to get heightened a little more. And then it's a like a regression because you already don't have enough and then you're stressed out. And then what you do have, you're just pulling and it's this cycle. So how do people break out of the matrix per se of like the worry, the anxiety, the pressure?
Yeah. Well, that's the same as fear is an easy one because everybody knows it. They felt that. Or anybody that's had a belly laugh, right? If you ever had a big belly laugh and you laugh, something changed in your chemistry because you feel different if you've had that kind of a laugh, and that changed your chemistry in a different way. And so the thing that people don't realize, they have a control knob. There's a knob that they can get, and they can turn this knob with what they're thinking and what they're feeling. The trick is you have to feel it, right?
Yes.
If you sit here and think I'm scared, you don't get that shaky feeling, but you have to feel scared to get it. The same thing with joy or love or gratitude. And if you feel that gratitude, you can start changing your body chemistry. And I tell people this all the time to help them shift. And the thing is, you've got the knob in your own hand. You can turn it. You just have to teach yourself how. And it's not hard. We have a couple of things we use to teach people that sort of thing, but it's something you could learn on your own, or we can help you if you come here.
Absolutely. And I also want to mention just to our community here that he's right. You absolutely have the ability to turn that knob off. I don't think that you realize how bombarded we are with things until you get away from it. I actually took the full month of October. I went to a flip phone. Everybody laughed at me. I didn't get on any technology, and it was right after the hurricane, and I just needed that. And when you come back to it, you don't like you hear an ad every 3 seconds. And I looked it up. It was like the average American sees like 10,000 ads a day. Sees or hears. That's a ton of like things going into your subconscious, and that's getting into deep stuff. But your conscious mind is like, I'm not afraid, I'm fine. Your subconscious is like, oh, everything's bad. Like, when you watch the news, even if you're not consciously like absorbing it, you're still subconsciously absorbing it. So I just want to encourage everyone that it's okay to be aware of things, but your subconscious picks up on everything. 100% of everything you think, everything you go through. And what helps me is getting away from the media all the time. Putting good things in, like sometimes it's helpful. I know everybody's exhausted and this world is just exhaustive, but I think if you take a moment of your day, 10-15 minutes, sit back and just reflect on the good things of that day, keep a journal, those sorts of things are so restorative because you get in this pattern, like he said, about bad, and then it just says bad, and then your symptoms are worse. And I've always said that chronic illness is like you're sitting in a pot of boiling water, but when your mental health goes down, you put a lid on it. And when your mental health is okay, you might still be in that pot of boiling water, but you can breathe and you can see out. So we talked about diet, we talked about mindset. So you are holistically minded. So as far as like meditation or affirmations, what do you recommend for chronic illness patients?
Well, I recommend they start getting control of their own body chemistry. And that's a kind of a meditation, but it's pretty simple. I mean, to meditation, people try and make it so hard because what they do is they sit there, they try and quiet their mind. And of course, your brain is designed to keep busy, especially some people have a very busy brain and it just wants to think things. And so it's not really trying to stop your brain, because if you try and do that, you'll just get discouraged.
Yeah, don't think about the pink elephant, and then you don't think about pink elephants.
Yeah, well, but what you do is you calm, and if you can only calm for a few seconds, and focus maybe just on something like your breathing. And so just focus on your breathing for a while, and then your thoughts will come in. You'll look at those thoughts. You'll say, "Oh, I know I'm thinking that," and you go back and you start again. And so just it's a circle. You just circle around, and your thoughts come in. Oh, then you go back and you calm yourself and do it again. And if you happen to go to sleep, that's fine. I mean, there's no don't be judgmental about, oh, I'm not good at this, because that's a formula for disaster. You'll end up quitting. So just keep on going, and you'll over time get better and better. It's like any kind of new skill that you may have had. When you first learned to ride a bike, you didn't jump and ride right away. Probably you had to pedal and stabilize, and you were shaky for a while. But over time, you get it, and so it's like that. And so I tell people, be persistent and don't give up just because your brain's going to be off thinking 100 things, because your brain is designed to think things like that. But just calming your spirit, being mindful about what you're thinking, and noticing what you're thinking. If you're thinking about some bad thing all the time, you think, why do I think that? Maybe I should think about something else. Because people often, go to the worst thing in their life and they think about that all the time. Yes. And that's not doing your health any good. You need to get back to the goodness. There's so many wonderful good things that happen each day. There's a million things. If you just notice them, people often notice the bad stuff, but they often fail to notice the good stuff. And so that's where I start with it. It's simple enough. And I know it's easy to say, but if you can, we have some classes here, or you can pick stuff up online. There's a lot of ways to do it. But I wouldn't recommend for a beginner to sit down and try and get 20 minutes of quiet. Yeah. Because that was just it's so hard to do, even for a few seconds. At first, anyway, people can do it later on if they're trained. But at first, just give yourself 2 minutes, and you're not going to be able to do it for 2 minutes. You'll be a few seconds, and then you'll go back in and do it again, and just keep practicing and don't give up.
Absolutely. And like I said, I love that TCM just hands you all these tools that you haven't ever thought about. And, I know that there's a lot of us watching that have gone through medical trauma, and it's very hard that when you do have symptoms or something, I think we kind of get freaked out because we think, am I getting worse? Am I going to end up in the hospital? And that's something that I've really had to work through myself. So, there's a quote that really helped me with that. And it says, once you let your past go, it can no longer hurt you. And so I think it's so important that those of us that have that medical trauma, and I know it's easier said than done, because I'm in that situation too. But when I clicked it in my brain that just because it happened doesn't mean it's going to happen again. And then I could see, like, the affirmations that I do are, I appreciate this form that I'm in. It serves me. Does it look the way I want it to look? No. And you can ask Dr. David. I'm always whining about something that's going on. And, he's literally had to tell me, like, look, you have to honor this form that you're in. And it's helpful to say an affirmation like, I'm getting better every day. Because once you say these things, your cells hear you. And when you have this positivity, instead of like, oh, I'm getting sick, I'm going to be disabled, whatever, I can't tell you the paradigm shift that happens when you break free of that. I'm sick. Do I have a condition? Yes, but I am not sick. So.
All right. Yeah, and I also want to encourage, a lot of people out there have had a situation where they've had some trauma, and they've been through Western everything. And they has not got all the results they want. So I encourage you to try some form of natural medicine, whether it be a clinic like mine, or any form of natural medicine. That you don't give up. There may be answers for you that can make your life better. it may not fix you 100%, but it maybe make your life so you can sleep, or maybe give you the chance to maybe have some joy that you might not have had before. So don't give up. Keep looking for your answers, and be persistent, because it's not the end of the world if Western medicine has given up on you. Even if you haven't given up on it, sometimes they've given up on you. Well, I see it all the time. Maybe people's insurance quits paying, and so then they don't get treatment anymore. You're done because we're done.
Yeah.
You're done paying. But there's things that you can do on your own, and there's a lot of natural solutions that you can follow, and it will help you get a better quality of life and live a more joyful life. And at the end of the day, it's all about living a more joyful life.
Absolutely. And, I just want to make the point too, that it takes a balance of things. Am I on cortisol replacement? Absolutely. Yes. Sometimes with the cases of cortisol and insulin, you need pharmaceuticals. We're not saying go off of those. No. What we're saying is these are adjunct tools that you can do in addition to whatever your, condition requires. And I found that once I got my body a little better, I was able to cut back on my cortisol. So you never know what your body's capable of. I don't like when people just automatically say, oh, I have this. We might have to deal with that condition, but we are not that condition. The same to go with weight. You are not a fat person. You have fat. Like, you have fingernails too. You're not a fingernail. So I think the language that we speak to ourselves is so important. So I thank you so much, Dr. David. Did you have any closing statements for us?
Well, one thing about that appearance thing, just because you brought it up, you came into this world, you have this physical form. This is your form. And it may not be the form of John Wayne or some, character.
You're telling your age there, Dr. David.
Some handsome person on TV, Brad Pitt or somebody, but it's what you've got. And it is magnificent. You see, because you're conditioned to say that's beauty. Don't confuse beauty with glamour, and just take care of the valuable, beautiful asset that you have, that's your body, and always get your brain around loving yourself, because that's good. That makes good internal chemistry for you, good chi in general.
Yes. Well, thank you so much, Dr. David, for all your wonderful insight and for all that you do. One last question. So if anyone is interested in getting acupuncture treatments, they're probably not in Fort Myers, but how would they go about that?
Oh, I'm sure they can find someone in their local area, right? You want to find someone that's well trained, and interview them to make sure they're the kind of person you want to be with, and you trust them to work with you, because it is a lot of anybody whether it's an acupuncturist or an MD. You really want someone that listens to you, that works with you. And so I would recommend maybe a quick on the phone chat before you schedule something, so that you know who you're dealing with.
Well, again, thank you so much. And thank you for everyone who tuned in. If you want any more information, I will put Dr. David's clinic, Lotus Blossom Clinic, their information at the bottom of this video. And as soon as our website is back up, we will have it on our page as well. So thank you again, and Merry Cortisol Christmas.